Good morning and welcome to today's Dr. Anyoha's podcast. Today I am going to be talking about why babies die. There are a few things you're going to learn from this podcast today. Number one is to know some of the things that could make a newborn baby sick and even cause the death of a newborn. The second thing you're going to learn today in this podcast, there are some conditions in pregnant women that could cause a baby to be sick and even to the point of dying. Those conditions are when mothers have high blood pressure or what we call preeclampsia. Another condition in the mother that could contribute to a newborn being sick and dying is when mothers have diabetes, what we call gestational diabetes. That means diabetes during pregnancy. Another thing that could happen in the mother that could contribute to a baby being sick to the point of dying is, of course, when the mother has prolonged labor. We're going to talk about some of these things in the podcast. And there are also issues that could come from the newborn, medical issues that are not compatible with life. For example, when a baby inherits a severe genetic problem that is not compatible with life, that could obviously affect the life of a baby as well. And of course, when babies have severe structural abnormalities like heart condition or brain conditions or lung conditions. So these are some of the things that can come from baby itself. We're going to talk about it in the podcast. Another reason why babies get sick and die after birth is hypoxia. Hypoxia is when a baby does not have enough oxygen in their body. Because of hypoxia or lack of oxygen in the baby's lungs and tissue could come from when a baby is inside the womb and there is problem with the blood supply to the baby, like problems with placenta. The placenta is the organ or the conduit through which oxygen is supplied to the baby through the mother. So if there's a problem with the placenta, for example, if there is a bleeding between the baby and the placenta, it cuts off oxygen that is coming from mom to the baby. That could be a serious problem, but we're not going to really talk too much about problems with placenta because sometimes it's not very easy to diagnose. But the cause of hypoxia could also be from a baby inhaling secretions from the amniotic fluid or secretions even after the baby is born. If a baby inhales secretion from the amniotic fluid, especially what we call meconium aspiration. Meconium is the first stool the baby passes. Sometimes the baby could pass the stool while in the womb, and as the baby is being born, the baby could inhale or breathe in some of these meconium, which is thick secretions, and it clogs the baby's nostrils, pharynx. This thick meconium, thick stool, clogs the baby's airways, nostrils, vocal cord, and the baby could suffer hypoxia. When a baby can't breathe, oxygen can't get into the baby. So baby could have serious problem and even die if the baby is not helped to clear that meconium around his nostrils, around his throat. Also, not only meconium, babies are surrounded with fluid, amniotic fluid when they're born, and some of this fluid come out with the baby as the baby is born. So there's a lot of secretions around the baby's face, mouth, nostrils that is not meconium that can also block the baby's air passage and prevent the baby from breathing. What the clinicians do, what the nurses do, what the doctors, the OBGYN doctors do is to try as much as possible to suction those secretions from out of the baby's nostrils and mouth and throat so that baby can breathe and get oxygen. A baby who doesn't get oxygen and air because of secretions could die. Fixing this is very easy by using bulb suction to suction the baby's nostrils and throat. And of course, assisting the baby with positive pressure ventilation, which is a small device that should be available everywhere a baby is being born or delivered. We're going to talk about that a little more in the podcast. Also, we're going to talk about prematurity. When a baby is born premature, we're going to talk about the challenges babies encounter when they're born premature. Mostly, the problem they encounter is breathing difficulties because their lungs are not developed. So babies who are born prematurely have breathing difficulties, and the hospitals, the doctors, the pediatricians should be anticipating some of these babies and prepared to help them with breathing. Even when a baby is born, the baby still faces challenges with the caring of the umbilical cord, which is, if it's not cared very well, could be a source of infection, because the umbilical cord has big blood vessels, and those blood vessels could transmit infection. Umbilical cord has big blood vessels, and those could transmit infection to the entire baby and cause baby to be sick and die. Even when baby is born, baby could still contract infectious diseases like diarrhea, and they can also contract other diseases like malaria, pneumonia, and die. So babies are not out of the wood yet after being born. They still face challenges. Now, a big part of why baby die is infection that is transmitted from mother to the baby during delivery or around the time the baby is being born. Infections can be transmitted to the baby through the mother. And one of the infections that everybody watches for is what we call Group B streptococcus. Group B streptococcus is a bacteria that could affect newborn babies. The way it happens is that pregnant women and women who are about to deliver, they are known to carry this bacteria in their birth canal and around their birth canal. And those bacteria, those group B streptococcus they can go from the birth canal to the womb to the amniotic fluid where the baby is and infect the amniotic fluid. So, in other words, the amniotic fluid will be teeming with thousands and millions of bacteria of group B strep. And because the baby is right there in the amniotic fluid, this bacteria could implant in babies' mucous membranes like eyes, skin, mouth, even lungs. The baby can inhale some of these bacteria and it can affect the baby. And when the baby is born, these bacteria begin to multiply and make the baby sick. And if not treated on time, this baby could die. The challenge, the right thing will be to prevent a baby dying from this bacteria, which is very known to cause illness in babies. To prevent a baby dying from that, what the OBGYN doctors do is to surveil the mother, to check the mother, especially during a time that a baby is due to come out, like during 37 weeks, 36 weeks pregnancy, around the time the baby is about to be delivered, to check the mother for this bacteria, to check if mother has this bacteria. If the mother has this bacteria, then the OBGYN doctors will treat the mother. When the mother is treated, it wipes out the bacteria from her birth canal and therefore prevent those bacteria from going into the amniotic fluid and affecting the baby. The baby can also be affected by this bacteria at the time the baby is being born if the mother has a lot of this bacteria in her genital tract. So it is quite important and serious for the OBGYN doctors to monitor and treat mothers, pregnant women at appropriate time to prevent group B streptococcus from affecting their baby when the baby is born or when a baby is being born. So that is critical. And if not done, the baby is going to get sick. The baby could suffer from a lot of diseases if this group B strep is not treated in mothers and therefore infect the babies. The babies can get sick. Even if they survive, they will suffer from sequelae, consequences like vision problems, hearing loss. Some of them can be mentally challenged, mentally retardation, and sometimes seizures and death. So treating group B streptococcus is one of the ways to prevent a baby from dying. Another thing that can cause a baby to die or get sick, very sick, is when there is a mismatch between the mother's blood group systems and the baby's blood group systems. If that happens, some elements, what we call antibodies, from the mother would go to the baby and destroys the baby's blood cells, red blood cells, and cause the baby to be anemic. And if it's not recognized on time and treated, this baby could become very sick and perhaps die. So part of saving babies from dying is to anticipate what is going to happen and prepare for that. Anticipate what is going to happen and prepare for that. That is part of ways to save babies from dying when they're born. This starts with seeking out a qualified OBGYN doctor or a qualified OBGYN team, seeking out a qualified pediatrician to be around when your baby is being born, and seeking out a standard hospital that has the basic equipment to save the baby when the baby is born and run into trouble. All these things have to be intact for a baby to survive, especially if there's a problem. Fortunately, a lot of babies will do well anyway, no matter what happens. There are quite a few babies who would need everything to go right for them to survive. One more thing, not all babies are the same. There are babies who beat the odds. In other words, despite everything they've been through pregnancy, through delivery, they still are healthy. So not every baby is the same. Every baby is different. Some babies are resilient and might survive a lot of these adversities. Not every baby is the same. Some babies will do well despite every adversities that came their way. So I don't want to put every baby in the same basket. Babies are different. And for some reason, some babies could survive adversities more than others. But you don't want to take a chance with your baby. So you have to seek out, like I said, a standard hospital with a good OBGYN team, obstetric team, a standard hospital with pediatricians, and even those who have interest in newborns, the neonatologist, and a good hospital that have the equipment to take care of your baby should there be adversities, especially if your baby is going to be premature. That is very, very critical. So in other words, a lot of the things that could affect babies when they are born could be foreseen by surveillance. Surveillance means surveilling the baby in the womb with sonograms to see how the baby is developing. Surveillance means surveilling the mother and to monitor the mother for this invasive bacteria called GBS, which is group B streptococcus, that could affect their baby when their baby is born, and treating the mothers if they happen to have group B streptococcus in their genital tracts. You see, babies are not supposed to die the way the parents envisioned a new baby that the mother has carried for 9 months, did everything that she could do, and with all the expectations, the grandparents, the friends, the names, all the ceremonies that precede the arrival of a newborn. There's a lot of anticipation when the baby is in the womb. Everybody is expecting the baby, so the baby is not supposed to die, but they do. They do die, and this podcast is prompted because a relative of mine lost a baby in Nigeria, and I wasn't able to help because the doctors over there thought it wasn't necessary to get me involved, especially given the fact that I am a pediatrician, number one, and a pediatrician who cares and knows a lot about babies, newborns, here in the United States. There are different kind of doctors, and doctors have different interests, but some pediatricians have interest in caring for newborns, even premature babies. So I was kind of disappointed when they did not Let me know what's going on with the baby, especially when parents were interested in me getting involved and finding out the circumstances of date and trying to see if there's anything I could have done or could do to prevent this date when this baby was alive. But that's by the way. So that prompted me to actually go forward and do the podcast and video recording on the date of newborns, especially babies who are born 37 to 40 weeks, who are term babies. Term babies means the mother carried them for 9 months, which is anything from 37 to 40 weeks is a normal term of a baby. So why do babies die? Why? It happens everywhere in the world, but the incidence, the rate at which babies die in the so-called poor resource-limited countries is very alarming. 1 out of every 30 babies born in places like Nigeria, for example, or some West African countries, 1 out of every 30 babies born die within 7 days or 14 days of birth. That's too many babies lost. Compared to places in the United States or Western countries, United Kingdom and Japan and other industrialized countries where 1 out of every 250 babies die. So babies do die, but they die for different reasons in the so-called resource-poor countries. I call them countries who are not interested in babies. No country is poor if they want to take care of their babies. They're just not interested in the babies. That's why the babies are born and they die. So why do babies die? Why would a baby who is born at 38 weeks, 39 weeks, 40 weeks, who weighs 3 kilograms, 4 kilograms, 7 pounds, or 9 pounds, why would the baby die? That is intriguing, very heartbreaking circumstances for moms, dads, parents, grandparents, friends, families, everybody who's interested in seeing this baby go home after delivery, go to the family and grow up and begin to smile and walk and do what babies do. And in fact, these babies are named before they're born. So there's a lot of investment in these babies before they're born. So for a baby to die after birth is a traumatic event, not only to parents, like I said, to parents, grandmother, friends, families, but also to the doctors, to the physicians, obstetricians who've cared for these babies for months, and for the pediatrician too. But some of these things are preventable. Some of the deaths that occur in babies are preventable. I should know because I'm a pediatrician and I take care of newborns in hospitals, also in Neonatal Intensive care units. So I should know 1 or 2 things about babies. I go to delivery rooms. They call me to attend delivery rooms when the obstetricians are expecting or anticipating a high-risk delivery, when they're anticipating the baby is going to need some resuscitation or need some help with breathing and heartbeat and all that. They call me. I know a little bit about babies. So let's dive down into this presentation and talk about why babies die. Why babies die and why many of these causes are preventable. In other words, they don't have to happen. Babies don't have to die. In places where things are properly set and where rules are followed and where the doctors and the pediatricians know what they're doing and the hospital itself know what they're doing. When they're prepared for these babies, babies are not supposed to die. And that's why there's disparity between the number of deaths of babies that are born in places like Nigeria, for example, where I come from, and compared to places in the United States where I practice. Whereas 1 out of every 250 babies die in the United States. 1 out of every 30 babies die in places like Nigeria, where I come from. What is the difference? Things that could cause a baby to die sometimes begin before a baby is born. We're talking about babies who die after birth. I'm not talking about babies who die in the womb or who die before birth. I'm talking about babies who die after birth, like 7 days, 14 days after birth, less than a month after birth. These are heartbreaking. Some of the reasons could start from the mother, for example. A mother who has a fever, for example, who has an infection or who has a urinary tract infection or any kind of infection and has fever and is pregnant and is about to deliver. This infection can go from the mother to the baby through the placenta and through the umbilical cord and cause infection in the baby when the baby is born. So a mom who has infection through their urinary tract system or from anywhere, if you're pregnant and you are infected with bacteria, that infection can go to the baby while the baby is in the womb. And when the baby is born, that infection stays with the baby. And if that infection is not treated, if the baby is not treated for that infection, the baby is going to die. This baby is going to be sick and die from infection that was transmitted to him or her through the mother. What is the simple solution? The simple solution is for the doctors, for the obstetricians, to surveil pregnant women, to surveil them, to monitor them, make sure that they don't have fever, and if they have fever, to treat that fever, to treat that infection, so that infection would not get into the baby and cause the baby to die when the baby is born. If the mother is not treated properly for an infection, then the baby could be treated too when the baby is born, and there is evidence that the baby has infection. The baby could be started on IV antibiotic to eliminate whatever infection is in the baby that was transmitted to him or her through the mother. In places where babies are being born and delivered every day in the whole world, you have to surveil the mother for infection and then treat the baby whose mother have infections. And when in doubt, you still treat the baby until you are 100% sure that this baby doesn't have infection in the system. And the way to do that is to obtain blood tests, get a blood culture, and surveil the baby's blood system for infection in the system. This is one of the reasons why babies die, because infection transmitted to them from the mother is not recognized and treated on time. So that's one main reason why babies die. Another reason is where a mother is in a prolonged labor. Mother is exhausted, baby is exhausted because the mother is in a prolonged labor. And perhaps the baby's head is stuck in the mother's birth canal, and there's no experienced obstetrician to figure out what is going on. So when this baby is born with their head stuck in the mother's birth canal, the baby is going to be lethargic and weak and needs an experienced pediatrician with resuscitative equipment to help this baby breathe. But then this kind of situation should not be allowed to happen anyway. There are ways to intervene for prolonged labor and obstructed labor, which an experienced obstetrician can figure out in a minute, including vacuum extraction of the baby when the baby is stuck in the birth canal. When moms have high blood pressure, or what we call preeclampsia, the baby is also at risk for underdevelopment, and at risk for stress, and at risk for low birth weight. When moms have high blood pressure, the obstetricians tend to deliver the babies as soon as possible, especially if they cannot control the blood pressure, which means that babies whose mother have high blood pressure might be delivered prematurely, because that is one of the ways to fix high blood pressure in women who have preeclampsia. So what do you do if a baby is delivered prematurely because the mother has uncontrolled preeclampsia? What do? You have to have a system that is prepared to deal with a premature baby. If you don't have that system, the baby is going to be born premature and the baby cannot breathe and the baby will ultimately die. So that is the second reason in the mother that can cause a baby to die after birth. A third reason might be mothers who have diabetes. When mothers have diabetes, their babies are born very big. When these babies are born very big, the babies also suffer from low blood sugar, what we call hypoglycemia. So a mother who has diabetes, especially during pregnancy, their babies are born very big because of the sugar going to the baby to make the baby look big. Big babies have low blood sugar. And if you don't recognize that on time and don't feed the baby on time, the baby can go into seizures and then die. So part of ways to prevent a baby dying when a baby is born is the prenatal care that goes into the mother before a baby is born. The setup for the surveillance of the mother's health. Surveillance of the mother's health, surveillance of what is going on with the mother, in the mother, before a baby is born. Because if the mother is not healthy, the baby is not going to be born healthy as well. And of course, mothers taking prenatal vitamins like folic acids and niacin could also help prevent some of the problems that occur in babies when the babies are born. So that is on the mother's side of what could go wrong and cause a baby's death. Now that we have talked about mothers' conditions that can predispose a baby for fatal outcomes, now let's talk about babies' condition that could also predispose a baby to fatal outcome, including death. In fact, there are some babies who die because not anything that has to do with mother or the obstetricians or the pediatrician, is just because of their genetic makeup. In fact, their structure, the way their organs and their bodies are made up. Babies are sometimes born with abnormal brains or some undeveloped brain, including breeding centers in the brain. There could be all types of malformations in the babies that can predispose them to death and mortality and risk for death and mortality. And it could be some genetic abnormalities, genetic setup. Sometimes some babies have genes that don't allow them to survive for a long time after birth. So there could be a reason why babies die as well. There are babies' condition that has to do with their heart. Arrhythmias like irregular heartbeat, maybe severe problem with the heart conditions. Let's say heart conditions. Heart conditions, severe heart conditions could predispose a baby to early death, dying within 1 week, within 14 days, within a month of life. So these are things that are possible. There are things related to cord, abnormality of the cord. Some cords are wrapped around the baby's neck and needs to be disentangled by a professional or an experienced obstetrician. Of course, things that has to do with hemolysis. Sometimes the baby's blood cells are hemolyzed. Babies can inherit a condition where their blood cells are hemolyzed severely and they are very anemic and they die. So these are some babies' conditions that can predispose a baby to early death. Some of these conditions in advanced countries, in countries where the health of babies are taken into consideration, some of these babies' conditions are known before a baby is born through sonogram, repeated sonogram of the baby, heart and growth and development. Some of these conditions could be picked up so that the hospital, the obstetricians, the pediatricians set up adequately to receive a baby who has some of these abnormalities. So these abnormalities are not death sentence for babies and should not be in 2024. Some of these conditions could be diagnosed before a baby is born and gives the pediatricians, the obstetricians, and the hospital enough time to get ready for this babies born with this condition, to save them and make them go home with their parents. And of course, prematurity is a big one when babies are born prematurely. And when the babies are born prematurely, like I said, they have difficulty in breathing, they have difficulty in maintaining their temperature, and those vital signs, the temperature and breathing, are maintained for them, in most part, by intervention, by equipment, like oxygens, like what we call CPAP, which is continuous positive airway pressure. So some of these babies who are born prematurely and can breathe, they have to be cared for in a very deliberate way, in a very intentional way. The hospitals have to be prepared to care for these babies who are born prematurely. Otherwise, the babies will die. The babies will die because they can't maintain their temperature, they can't maintain their breathing, and they will die. I don't see reasons why major hospitals in Nigeria, teaching hospitals, state-owned hospitals should not have at least a CPAP equipment, continuous positive airway pressure machine. I don't see why a state-owned hospital, a government-owned hospital, federal government-owned hospital, a big hospital should not have, a teaching hospital should not have CPAP in their facility and ready to ventilate and take over babies who are born prematurely. They should also have a ventilation machine. Those two things, a ventilation machine and or CPAP, and a respiratory therapy, somebody who's trained to monitor and take care of the machine while the babies are on the machine. There's no reason why that should not be possible. There's no reason why that could not be possible in Nigeria of today. We have talked about conditions in the babies that could predispose them to early death. And we've said that some of these conditions in places where they care enough for babies, some of these conditions could be diagnosed before a baby is actually born into this world. And because they're diagnosed before the baby is born, the hospitals and the doctors are ready to take over and manage these conditions, preventing death of a newborn baby. Other causes of why babies die within 7 days, within 14 days of, includes hypoxia. Hypoxia is lack of oxygen. If a baby cannot breathe, the baby will die. A baby who cannot breathe will die. So this is actually another cause why babies die. Hypoxia. What is hypoxia? Hypoxia means the baby cannot breathe and therefore cannot get oxygen to their lung and into their tissue, into their body system. That's what hypoxia is. And what causes hypoxia is a baby cannot breathe for a lot of reasons, including secretions around the baby's nostrils, mouth, and throat. Remember, a baby is swimming in uterus in the amniotic fluid. The baby is surrounded by fluid when they're in the womb. And when the babies are born, those fluids, the secretions, come out with the baby. Before a baby breathes, those secretions have to be suctioned, right? Those secretions have to be suctioned before a baby breathes. If you don't suction them, then you suction them quickly after the baby is born. But the secretions, if you don't suction the secretions, the fluid around the baby's throat and nostrils, the baby don't have a clear airway to breathe because all those secretions and fluid will be around the baby's nostrils and mouth and throat, and you have to suction them out. There's a blue bulb suction that could be used to suction a baby's nostrils and throat and pharynx and clear the airway and make the baby breathe. And if the baby does not breathe, then you can begin what we call positive pressure ventilation. The positive pressure ventilation machine, which is a simple device that could introduce oxygenated air into the baby's nostril and lung. And you're going to do that, you're going to stimulate the baby, you're going to warm up the baby until the baby starts breathing. So these are the simple measures that could be done when a baby is born for the baby to breathe. Clearing the airways with a small instrument called bulb suction to suction out secretions in the baby's nostrils and mouth is very important. Gentle stimulation of the baby, warming up the baby, drying up the baby and warming up the baby also makes it possible for the baby's temperature to remain stable. And then if the baby is still not breathing, you can begin what we call, like I said, positive pressure ventilation, which an ambi bag or a device, a small device that provides positive pressure ventilation, which every pediatrician who works in NICU or labor delivery knows. This is a simple device that should be readily available in hospitals in Nigeria. It doesn't have to be tertiary hospital or government hospital. It has to be available in wherever babies are delivered, especially babies who are high-risk babies, who are premature, who have anticipated condition that will make it difficult for them to breathe. So this equipment has to be there. They are simple and they do not cost much. A baby who is born and breathing adequately and crying adequately, what else could happen to the baby? The baby could still contract infection if the umbilical cord, the baby umbilical cord is not managed properly. If baby's umbilical cord is not clamped adequately and cut with sterile instrument, the baby could still give infection through the umbilical cord and die because the umbilical cord has a direct connection to the blood system of the baby. It's a source, it's often a source of infection that goes from the baby, from the umbilical cord to the whole baby and causes infection to spread around the baby system and the baby dies. So taking good care of the umbilical cord is very important in preserving the life of babies. Like I said, the umbilical cord has big blood vessels that connect to the entire baby. And if it's not taken care of properly in a sterile condition, that could be a source of infection that leads to baby's death. So this is important. And when a baby is born, obviously, there are people around the baby, and the baby could also die if they contract things like diarrhea. If they contract diarrhea, or if they contract cough and pneumonia, they could also die. So a baby who is born is not out of the woods yet. These babies are very fragile and delicate and have to be protected. They have to be protected all the time until they get older and tougher and able to fight off infection, able to adjust quickly. The first 1 week of a baby's life is very critical. The first 2 weeks is critical. The first month is critical. And the babies have to be protected with all means necessary. Babies were to stay alive and thriving. This is a very important topic to me, like I said, because recently I lost a relative, a baby relative of mine who we were expecting to celebrate with the parents and grandparents. I was popping champagne and then suddenly the baby dies. That is very heartbreaking. I'm doing this so that I can save other babies from dying. So we've gone through many of the things that causes the death of babies, newborn babies. We've mentioned infection in the mother that could potentially spread to the baby, and how it is important to recognize when mothers have infection because they have fever, and to treat the mother and the babies as well. And we also mentioned that there are things in the baby condition that could be noticed before birth, and so the hospitals can be ready to take care of a baby appropriately because of things that were noticed before the baby is born. We've said that it's important to surveil babies when they're in the uterus, when they're in the womb. It's important to surveil them with sonogram and see if there's any abnormalities that would necessitate intervention when the baby is born. And then we also stress the need for parents, for mothers to have prenatal care, take their folic acid and niacin, which might some structural abnormalities in babies. We said that. We also say that taking care of the babies when they are born, making sure they can breathe, and if they cannot breathe, to begin to help them with breathing, is a skill that pediatricians should understand and know and be capable of doing when in the labor and delivery room. For babies who are premature, who are anticipated to be premature, there should be special preparation for them. There should be special preparation in the sense that the place of birth should be a place that has adequate instruments to take care of premature babies. They should have instruments and equipment that supports breathing, because that's the most important thing that a premature baby would need to support their breathing. And they should also have medication that support breathing, like what was surfactant. So we've covered some of the preventable things that, as a pediatrician and as a pediatrician who's interested in newborn care, contributes to deaths in babies, especially babies born in the so-called resource-poor country. Please, the most important takeaway from this podcast and this presentation is to make sure before you have your baby or when you're pregnant, you serve the care of an experienced and skilled obstetrician, and serve the care of a skilled and experienced pediatrician, particularly a neonatologist, a doctor who is interested in newborns. We will call a neonatologist. A neonatologist will be doctors who are trained to take care of very, very newborn babies. Most importantly, you have to go to a center, a place of delivery where they have equipment to care for your newborn should there be any problem. Don't go to a place where they don't have CPAP, they don't have blood suction, they don't have ventilation machine when you're having a baby. It doesn't make any sense, especially if you're anticipating a problem, if you're anticipating an issue with a baby. You have to go to a hospital where they have a newborn intensive care unit, a neonatologist, that means a pediatrician who is an expert in taking care of newborn, and of course, a good obstetrician or OBGYN team who could take care of you, a good pediatrician, neonatologist could take care of your baby, and a good hospital where your baby have all the equipment to live and survive. You don't have any choice. You've carried this baby for 9 months. I don't want to have the same experience that my niece had after her baby was born and died about 7 days later. When it's not necessary. Not when the cause of death is preventable. Not when people don't want to disclose information to you. Please share this podcast, share this information with your relatives, with your parents, with your mothers, with anybody you know who is having a baby. Because things contained in this podcast and this YouTube could save lives. Like I said, I don't want any more tears, I don't want any more heartbreak, especially when this is preventable. Thank you so much. And please, like I said, share this with your friends and family.